Mabuhay! I am Dr. Reynaldo ROJoson, Director of ROJoson PEP Talk. Today, October 16, 2021, marks the second milestone in the ROJoson Patient Empowerment Program, or ROJoson PEP Talk for short. The first milestone was the launch of the ROJoson PEP Talk in May 15, 2021. The second milestone is this Achievement Day of the first batch of achievers, or medically empowered persons. Allow me to explain briefly the first milestone before we focus on the second milestone. I have a patient empowerment program as early as 1982. I have been continuously improving it. My latest innovation was when I launched the ROJoson PEP Talk on May 15, 2021, a regular online or virtual talk on health concerns and issues done every Saturday, 2 to 3 p.m. using the Zoom app. The talk is limited to 1 hour with less than 30-minute talk, followed by 30-minute questions and answers and interactions. It is accompanied by an online learning cum evaluation test exercise, or OLETE, after each session. Basically, OLETE is an online test and or exercise that has for its objectives the simultaneous promotion of mastery of learning and evaluation of the learners or students. Attendees who get a perfect score would be issued a certificate of commitment and accomplishment like the one shown below. The main reason why I still strongly advocate the patient empowerment program for the Filipino lay people is because of the presence of ever confusing medical information and also confusing health professionals. The program is needed to equip the Filipino lay people or patients with at least basic knowledge, skill, and attitude to make educated, well-informed, rational, and cost-effective decisions on their health concerns. The ultimate target is quality and safe health care for the Filipino people or Filipino patients. In the process of my interactions with the attendees and mentees in the ROJoson PEP Talk, we came out with a Tagalog translation of the patient empowerment and its components. Pagpapalakas ng pasyente, the K4 in patient empowerment, kaalaman, knowledge and understanding, kakayanan, capability, karapatan, rights, kapangyarihan, self-determination. There are 3 courses in the PEP Talk: the core course, health disorders courses, and health issues courses. There are 4 modules in the core course: patient empowerment program, patient management process, rights in patient empowerment, and staying healthy and contented. There is a total of 17 parts or sessions in the 4 modules in the core course. What is patient empowerment? Strategies in patient empowerment. When is a patient empowered? In the module Patient Empowerment Program. Overview of the patient management process, clinical diagnostic process, paraclinical diagnostic process, selection of treatment process, advice to patient process, peculiarities and limitations of medical practice in the module Patient Management Process. Basic rights, patient autonomy and advance directive in the module Rights in Patient Empowerment. Introduction and Intentional Living Plan, healthy lifestyle plan, screening and periodic health check, early diagnosis and early treatment, first aid and basic medical care, food supplements, are they necessary? In the module, Staying Healthy and Contented. The core course was completed on October 9, 2021. As mentioned earlier, today, October 16, 2021, marks the second milestone in the ROJoson Patient Empowerment Program, or ROJoson PEP Talk. Today is the Achievement Day. Today, we will give recognition to the first batch of mentees who satisfactorily completed the 17 OLETEs for the core course and 3 essential projects of the Patient Managed Empowerment Program, namely Advanced Healthcare Directive, Intentional Living Plan, and Healthy Lifestyle Plan. For their accomplishments, they are entitled to get a certificate of proficiency in patient empowerment. They can now be called medically empowered persons. They will be receiving such a certificate of proficiency in patient empowerment. The medically empowered persons, or MEP. Elsa De Leon Dantis, MEP. Corazon Go Joson, MEP. Monica Ibarra Alagos, MEP. Mary Ann Agustin Jose, MEP. Cecilia Mendoza Cruz, MEP. Maria Clara Jesusa G. Guzman, MEP. Camille Marie Therese Ik Joson, MEP. Rex T. Tolentino, MEP. Deli Joson Lim, MEP. Meli Joson Ngo, MEP. Perla Bello Pascua, MEP. Maria Karina Evangelista Lim, MEP. Mabel Navarro Cordova, MEP. Concepcion Valenzuela Quevedo, MEP.
Good afternoon, everyone. My name is Chuchi Quevedo, and I'm a cancer patient of Dr. Roson. When I got my invitation for the May 22 pep talk, I was quite hesitant because I was afraid I might not be able to complete the sessions. But I was thinking, how can I turn down this brilliant doctor who is the mentor and idol of my brother and has nothing but goodness and kindness in his heart? And added to that, the topic was so timely, COVID-19. So I accepted it and I'm so grateful that I did. Even if it was in conflict with my busy schedule, he made it very easy for us to catch up with his lectures. Admittedly, at 75 years old, I needed to sharpen my concentration to be able to absorb and remember the contents of the lectures. The OLETE exams were easy, but again, one has to perfect it to make sure that one understands it well. The OLETE also taught me a lot of patience and perseverance when taking it, because there were times when I would miss one number, but I had to go back and review it again and again. But when I get a perfect score in one sitting, ah, what a wonderful feeling. Little did I know that I would be able to apply my kaalaman and kakayanan and karapatan sooner than I thought. I have this 90-year-old friend who went to see a doctor for regular checkup. She was referred to a surgeon because of umbilical hernia. The surgeon practices in a big popular hospital and told her to prepare for surgery. My friend has no relatives in Manila and was so dependent on me. I knew that she has had this ailment for many years already, but did not really complain of pain and just a little discomfort due to the bulging stomach. I knew little about hernia, so I read about it and thought it best to advise her to get a second opinion. The second doctor told her that considering her age and considering further that there is really no sign of strangulation, it is best to postpone the surgery when there is an emergency already. My friend was so happy about my advice to her. On another occasion, my niece called up last September crying and saying she didn't know what to do. Her 74-year-old mother was brought to the hospital because of a stroke. She recovered from the first stroke, but a second one happened again after 2 days, leaving her in a coma. My niece said that the doctors wanted to attach her to a machine, but she cannot decide on it. I was able to make her calm down. Then I advised her to tell the doctor on duty to allow her mother to just die naturally, and that it should not bother her conscience at all because her mom had a slim chance of survival. Much besides, their finances are so limited. After some time, my niece calmed down and did what I told her to do. These two experiences made me appreciate more the pep talks that we had been enjoying all these months through the tutelage of our dear Dr. ROJoson, and I really feel empowered now because of my added kaalaman, kakayahan, and karapatan. Thanks to you, Dr. Hoson, I wish that more people would join your future pep talks. Thank you.
The medically empowered persons, or MEP. Jezreel Tolentino Hernandez, MEP. Aida S. Antonio, MEP. Cecilia Rivera Ramos, MEP. Maria Nenita Rivera Ramos, MEP. Joanne C. Uy, MEP. Janet Uy Yu, MEP. Ray Benjamin Ik Hoson, MEP. Marisa Judith M. Basa, MEP. Elena Enriquez Veloso, MEP. Gerald A. Francisco, MEP. Gerald Ellison T. Tan, MEP. Karine Cristel Lim Tan, MEP. Ricardo Ong Hoson, MEP. Amor I. Hoson, MEP. Katrina May I. Hoson, MEP.
Hi everyone, my name is Katrina and I just want to share something about Dr. Hoson's pep talk, kung ano po yung naging epekto nito sa aming pamilya and what it meant for the mentees. Ang pep talk po, it's something we look forward to every Saturday. It became part of our weekend routine. And actually, ang father ko po, he would rush from work just to attend on time po sa pep talk. Yung pep talk po kasi naging, ano na rin namin siya, parang one way para makapag-bond as a family. Noong una, parang attend kami, makinig, and then sagot ng alete. Pero habang tumatagal po, dumadating na kami sa point na nagbabatuhan na rin kami ng ideas. Nagre-reflect kami sa mga naging topic. And as a family, nagde-decide kami sa kung ano ba yung dapat gawin. Like for example po, yung latest na topic yung sa food supplements po. Actually, guilty po kami na madami kaming tinitake na food supplements, especially po ngayong pandemic na andaing naglabasa, makita mo lang sa Facebook para may mga testimony na ganito na tinitake nila, okay yung katawan nila. So ikaw din, bili ka din, ganyan, lalo na kapag may sale sa Shopee, bibili ka din. Doon po sa pep talk, parang naging eye-opener siya na, yung mga food supplements na to, pwede naman pala natin i-take, makuha sa mga pagkain na kinakain natin. Pumili lang tayo ng tamang pagkain. And yung akala mo na nakakatipid ka sa pagbili ng mga food supplements, in the long run, parang hindi din pala. Kasi it would cost you more, lalo na kapag may mga tinamaang organs na sa'yo. So sa pep talk po, it helped us na i-weigh mo na yung bagay-bagay bago kami mag-decide. So I believe po, ang naging impact nitong, malaki po yung naging impact ng pep talk. Hindi lang sa amin, pero doon sa mga co-mentees namin. Kasi parang mas naging confident na tayo. Mas naging confident na tayo over decision making, lalo na pagdating sa health natin. Like for example po, ako po, personally, pag nagpapacheck up po ako, lagi po akong oo ng oo lang sa doctors. Kasi hindi ko po sila naiintindihan, lalo na po kapag puro medical terms yung sinasabi sa akin. Pero po, sa pep talk, doon, binigyan ako ng guide. Binigyan tayo ng guide na pwede naman pala tayong makipagbatuhan ng idea sa doctors, pwede naman pala tayong mag-suggest bago tayo dumating sa isang conclusion kung paano natin ititreat yung sarili natin. Ito pong pep talk, it helped us to have a strong control over our decisions and actions towards our health po. I believe po, it prepared us, it honed us, para mas handa po tayo nakaharapin pa yung mga pwede pang dumating, lalong-lalo na po pagdating sa kalusugan natin. Nagkaroon po kasi tayo ng guide dahil ito sa pep talk. Ang isa po sa pinaka-paborito ko pong naging activity sa pep talk is yung paggawa po ng Advanced Healthcare Directive, Intentional Living Plan, and Healthy Lifestyle Plan. Sobrang napapanahon po kasi lalo na po yung Advanced Healthcare Directive. Kasi po, di po ba ngayong pandemic, wala na tayong kasiguruhan eh. Hindi mo alam kung yung kasama mo ngayon, kasama mo pa bukas, kasama mo pa sa isang araw, sa susunod na linggo. So, kung sakali lang, wag naman po sana, kung may mangyari sa kanila, alam natin yung gagawin. Kasi ito yung gusto nilang mangyari, isinulat nila, ito talaga yung gusto nila. Tulad po kami, dahil na-COVID po yung both parents namin, both severe, nung una pong pinasok sa hospital kasi si Papa. Bago po namin siya dalhin, ang bilin niya po sa amin is DNR. Siyempre po, sabihin namin, sige, yan, susundin namin. Pero pag nandoon ka na po siguro sa sitwasyon, lalo na kung yung anak ang magdesisyon, siyempre gusto niya po ilaban, di ba? Ilalaban mo hanggang dulo. Pero kung merong ginawa si Papa na Advanced Healthcare Directive, hindi kami mahihirapan mag-decide, lalo na kung hirap na talaga. Kasi doon nakasulat na ito talaga yung gusto niya mangyari. Ako po kasi sabi ko kay Ahya, ikaw nang bahala, basta susunod ako kung anong sasabihin mo. Ang unfair, kasi pinapasa mo yung burden sa kanya dahil siya yung panganay. Pero dapat as a whole family kayo mag-decide. So, kung meron po tayong Advanced Healthcare Directive, maliles yung away-away within families. Kasi yan po yung realidad eh. Talagang pag may nawalang parent, dyan na mag-uumpisa yung away. Kasi ang hirap mag-decide. Ito pala yung gusto ng isa. Ito pala yung gusto ng isa. Ang ending, magsisisihan. Paano? Parang sasabihin nila, dapat nilaban pa natin. Ganyan. Pero yun nga po, kung may Advanced Healthcare Directive, kumbaga maluwag sa kalooban natin kasi sasabihin natin is, ito yung hiling niya. Let's honor his wish. Ganun po. Pero ayun po, okay po kami na Papa. Okay naman po kami hanggang ngayon po, nakasurvive po kami sa COVID naman po. Next po is yun nga po, sa Intentional Living Plan, yun po, binasa ko din po yung mga ginawa nila Papa. Yung ma-realize mo na at this age, anday pa pala nilang gustong gawin, anday pa nilang gustong mapuntahan, ganyan po. Lalo na syempre siguro ngayong pandemic, anday nating realizations na ang tagal ko nang nabubuhay sa mundo pero anday ko palang gustong gawin. And then sa healthy lifestyle plan po, yun, mas alam mo na kung ano ipaprioritize mo this time. Di po ba? So yun po, Dr. Roson, sobrang salamat po. Sana po, mas dumami pa yung ganito na i-organize niyo po kasi for sure, madami pa po yung gustong matuto at alam ko po, mas madami pa po yung gusto nyo matulungan. Yun lang po. Salamat po.
The Medically Empowered Persons, or MEP. Redin A. De Castro, MEP. Zenaida L. Cabral, MEP. Phoebe Jockson Caldino, MEP. Rochelle N. De la Cruz, MEP. Abigail del Rosario Hernandez, MEP. Maria Teresa Ong Lim Ong, MEP. Maria Lilibet R. Tumambing, MEP. Alvin D. Tumambing, MEP. Maria Cristina C. Sara, MEP. Isabelita C. del Rosario, MEP. Mary Chris Sumilay Nesesia, MEP. Josephine P. Espiritu, MEP. Lolita Uy Ramirez, MEP. Maria Justa T. Colotan, MEP. Gradis Jose Basig, MEP.
Good afternoon, everyone, to our mentor, Dr. ROJoson, my fellow mentees, all participants and attendees of PEP Talk. I am Rydis J. Basig, a breast cancer survivor and a patient of Dr. Joson. I am honored to speak to you on this special day, our Achievement Day, when we can all proudly say that we made it as the first batch of medically empowered persons. Congratulations then to all of us. Congratulations also and special thanks to our dear Dr. Joson, the prime mover, the force behind PEP Talk. When Dr. Joson launched his PEP Talk last May 2021, I immediately signed up because I would like to know more about this buzzword, patient empowerment. So I attended the first session. As they say, sold na agad ako sa unang upo at pakikinig pa lang. My interest started to build up until I was already hooked up. attending all the online 17 sessions without fail. The pep talk served as the perfect forum for me in becoming an empowered patient. That is why it meant a lot to me for 3 reasons. Firstly, through the pep talk core course with 4 modules, we became equipped with the basic knowledge and skills to gain greater control over decisions and actions affecting our health. We understood our rights as patients and the ways to exercise these rights. We were enlightened step by step with the whole process of patient management. It opened our eyes, for instance, that in the light of scientific evidences and studies, vitamins and food supplements to prolong life are not necessary if an adequate, balanced, and varied diet is being taken. Secondly, the pep talk allowed me to prepare 3 plans or projects. This is quite worthwhile and significant for me because I used to take this for granted. One is the healthy lifestyle plan to guide me daily to stay healthy and not crippled until the end day of my life on earth. Next is the intentional living plan to target a number of years in which I wrote down the things I wanted to accomplish before the inevitable graduation day, making me feel fulfilled, contented, and ready to die a happy death. And the Advanced Healthcare Directive to inform and guide my family in managing me when I am in a near-death situation. Thirdly, the pep talks learning became even more relevant to me, especially during this time of pandemic, when some of my family members showed symptomatic and asymptomatic tendencies of COVID. All the tips on immunity and resistance building, safety measures, and other learnings on home management of COVID-19 were very helpful to mitigate its spread. Walang kaduda-duda, marami po tayong natutunan sa pep talk. The online Olete is Dr. Joson's way of testing if we learn from every pep talk sessions. Now that we are medically empowered persons, let us try to maximize our knowledge, kaalaman, our capability, kakayahan, our rights, karapatan, and our self-determination or kapangyarihan, using them correctly and with much prudence. Of course, marami ang nagsasabi na marami pa tayong bigas na kakainin. That is why we have to continue educating ourselves through Dr. Joson's pep talk, which is given free. In fact, Dr. Joson has already lined up some forthcoming topics. We are indeed fortunate to have Dr. Joson guiding us in our journey of patient empowerment. What do we do from here? Well, let us not keep to ourselves what we have learned. Ibahagi po natin sa iba gaano man kalaki o kaliit ang ating napag-alaman o natutunan. Now that we are empowered, let us also empower others, our family, friends, neighbors, and loved ones. Let me end by quoting a sublime thought from poet Longfellow, who said, "No matter how humble, each has its own greatness to contribute to the world."
Before we officially end the program, I'd like to congratulate you, the first batch of the ROJoson medically empowered persons. I also like to thank you for the support you have given to the program and to the advocacy. And now I'd like to request you, please go forth and empower other Filipino lay people, especially your family members and your loved ones. Thank you. Mabuhay kayong lahat.